Um, my name's Jackie, and I'm one of the co-founders and executive director for Madelyn James Pediatric Cancer Foundation. And tonight we'll be talking about more than medicine, the amazing team, and people behind the cure. So we're joined by some amazing panelists today. We'll introduce shortly, and we'll explore the thought of when a child is diagnosed with cancer, medicine begins immediately, but healing requires far more than chemotherapy, radiation, other drugs that might be used too. And we wanted to make sure that the integrative care team, including families' perspectives, are shown when we talk about these things.
And I'm Dan, Maddie's dad, Hannah's dad. She was running around here earlier. I just can't thank you enough for all being here virtually and live. Hopefully you guys got some great Mac Mart. Shout out to Mac Mart for some great mac and cheese and some hoagies, and we got the bar, and thank you so much for the AKA for hosting us. And another big thank you to United Therapeutics for helping sponsor this event. Thank you for joining us from Boston, all the way from Boston. And again, thank you to the AKA University City for their generous support of our mission and being there for us since day one. We lived here for the better part of a year when Maddie was going through her treatment. So this is like our second home. And we even hosted Maddie's celebration of life right out there after she passed.
So of course we know all of this firsthand in addition to running Madelyn James.
When our daughter Maddie turned 4 months old, she was diagnosed with infantile leukemia. As new patients to twins, our world was turned upside down. We witnessed firsthand the importance of finding a team that cared about Maddie fully. Not just the most innovative and best medicines, but also how could we help her and have days and weeks of joy through her harsh treatments and months in the hospital. We founded Madelyn James a month after she passed away in her honor, and our mission is to increase access and equity for babies and toddlers with cancer.
And that's why we wanted to gather you all here today to celebrate the amazing teams that are more than just medicine for our kiddos. And we'll learn more and chat about the intersections of access, integrative medicine, and providing whole child, whole family support, just like we do at Madelyn James. And this is about preserving childhood, protecting mental health, and ensuring access for all families, not just those with resources.
And now, without further ado, I get to honor our amazing panel, and thank you for all being here. First, we have Julia Stiffman, MSW, LCSW social worker. Julia Stiffman is a social worker at CHOP in the Division of Oncology, Cellular Therapy, and Transplant Sections. She's been in the role for a little over 2 years and has 10 years experience working as a social worker in various healthcare settings. Julia is passionate about supporting family systems and reducing barriers as they navigate complex medical conditions and treatment plans. We can hold our applause to the end. Michelle Gendo, Child Life. Michelle Gendo is a certified child life specialist at Children's Hospital of Philadelphia and has been in the role for just under 5 years. Michelle currently works on the inpatient oncology unit, where she provides compassionate, developmentally appropriate support to patients and families navigating complex and often difficult medical experiences. Michelle is passionate about building trusting relationships with children and caregivers, helping them understand their diagnoses and treatments, and creating moments of normalcy and empowerment during hospitalization. She is especially committed to supporting families through challenging times with empathy, creativity, and individualized care. And Michelle met Maddie. She helped the girls with an art project at just 6 months old, and it's hanging in our house today. Jackie Bowers, Integrative Health Massage Therapy. Jackie Bowers is a licensed massage therapist who's been practicing massage therapy for 18 years. She's worked with adults and children and specializes in oncology massage. Currently, she's part of the integrative health team at the Children's Hospital of Philadelphia, a program that aims to integrate conventional medicine with complementary therapies in order to provide comprehensive care to pediatric patients. Dr. Lamia Baccarat, pediatric psychologist. She's the Director of Psychosocial Services and Behavioral Oncology Research at CHOP. She holds the Stephen and Susan Kelly Endowed Chair in Behavioral Oncology. Ashley Warmbrew, did I get that right? Ashley Warmbrew is an advanced creative arts therapist with the Cancer Center at the Children's Hospital of Philadelphia. And our family, Timothy and Alexis Neller. Parents turned advocates and experts in care. Tim and Alexis have 2 children who were diagnosed with cancer, retinoblastoma, and moved from Tennessee to PA for care at CHOP. Tim is a small business owner and Alexis is a teacher. They have moved mountains for their incredible kiddos, and I'm so thankful that you guys are here today. One of our favorite stories is when we first met, we brought our daughter Hannah to play with Thomas and Vivian. At one point, Tim said, "Come back here, Thomas, James." And Jack and I looked at each other and cried, like I'm crying now. Our daughter's middle name, or Hannah, who's running around, her middle name is Thomas, after my dad, and Madelyn James, happens to be Jackie's father. So it was like it meant to be.
Well, thank you, Dan, for introducing our amazing group of panelists, and thank you all for being here today. So let's get into it. I always really appreciate and like to start from a place of lived experience. And so, Tim and Alexis, if you don't mind, would you mind sharing a little bit about your story and really about kind of what you remember from maybe the day of diagnosis, specifically thinking about like who we have here in this room too, thinking about that psychosocial support, things that you might have wanted to need that you know you need in the moment now versus back then. So if you just speak to that, that'd be amazing.
Hi, everyone. So our journey began January of 2024. I'm a high school teacher. I went to work for mandatory training, and so Timothy took Vivian to an eye appointment since I couldn't be there. And actually, Tim, I think that's actually your part of the story to tell.
So I'm going to skip over a lot of just what happened, how it happened, and say that a lot happened really, really fast. And when you're thrust into that position, at the time, Vivian was diagnosed first, and so we had a child with cancer. And we were like, we had whole lives going on, careers, plans, holidays that we had just come out of, and we were hoping to catch up on some things, and now we're in this world. And so one of the first things that happened was we got a call from Susan Polton, and had no idea who this person was, but she's calling me, and she's from CHOP. What's CHOP? Like, we still didn't know all these things. And she explained what her job was and what she was going to do. And she said, "Where are you right now? Like, what are you doing?" I said, "I'm picking up our car from the mechanic because we're having to get our car worked on because we're about to have to take a car ride to Pennsylvania tomorrow. And our daughter has to start chemo the next day," or, it was just bam, bam, bam. And she was like, "Okay, take a deep breath." And was there to literally, not literally, but over the phone, take us by the hand and say, "Hey, the world's not coming to an end." And kind of help us take a breath and just gather it, take it all in and plan the next step. So.
So Susan was the very first person that we got to talk to, that we interacted with in this whole journey. And then I think the next person that we interacted with was Julie at CHOP, and she is Julie Strange. She is our child life therapist, and she has been amazing since like the very beginning. Just bringing in toys, books. Our son Thomas loves Thomas the Train, and Julie went on a mission to find Thomas the Train stuff for him to have while we were at the hospital. And Julie and Susan and all of the nurses there really helped our kids feel normal during all of this. Like, until you're in it, you don't understand just how life-changing it is. And kids don't know the difference, which makes them so resilient. It sucks that kids have to go through this, but they are honestly the best people probably to go through something like this, because they see every day as a brand new day. They don't know any different. They wake up and they're just like, so what are we gonna do today? And everyone was so amazing at helping keep their childhood alive while they were in the hospital. And then they were also great in helping us not lose ourselves in the medicine and the treatments and all of the scary things, because this is, honestly, it's a parent's worst nightmare. And for us, it was ×2. And so we are really, truly grateful for Julie, for Susan, for Jackie and Dan. I mean, I don't know if we'd be sitting here in front of you guys if it weren't for all of them. So truly, thank you. Yeah, being able to talk about our feelings. We have big feelings.
Oh, thank you guys.
Please, somebody else talk about their big feelings.
Well, thank you all for sharing. I really believe it's important to start with that perspective, and I think there's so much expertise in having that lived experience that too many of us in this room actually have as well. And so I guess, we can talk more now about, from anyone on the panel that's interested, but like what, from your all's perspective, what happens emotionally to a child at diagnosis? Take that.
Do I sound okay like this? I think to simply answer that question, they are thrown into an environment that's brand new, depending on the age, right? They're starting to become more independent. They have their routine. They have kind of what the ins and outs of every day looks like. And instead, you now have no more control. You're being told what you have to do. And to simply answer what happens emotionally, they shut down. They shut down. They are scared. They are worried. They are nervous. They really feed off family, and appropriate families, devastated, distraught, and don't really know how they feel themselves. So kids shut down at diagnosis. It's a scary and hard time.
And what about the rest of the family, right? Because we talked about from Tim and Alexis's perspective, we know from our perspective too, but what does that support look like from your all's perspective for the family, the siblings, the parents, caregivers?
It is really difficult for the entire family system when they receive a diagnosis of cancer. Basically, when someone receives a diagnosis, it may feel like their entire world has shut down. And in many ways it has. However, the world is still going on around them, and parents, in addition to grieving the sense of normalcy that they were expecting for the next year, several years of their life, they're now having to, parents and siblings, kind of consider different possibilities of what their life, both daily and a future, will look like. And they're also trying to figure out how they will support their child or children while making sure that they can maintain income, insurance, all the things, basic necessities, food, clothing, shelter, while dealing with this incredibly emotionally difficult diagnosis.
What does it look like from the overall CHOP perspective? I know we obviously have everyone here in this room, so we have a lot of different specialties, expertise, and services. But what does when a child is diagnosed, when a family comes in, kind of what does that look like in terms of the triage, the team that steps in and from the integrative medicine and psychosocial support side of things?
So I would just add, and to answer your question, that while we expect and know that a cancer diagnosis is distressing, potentially for the patient, depending on their age, and the extended family, we also know that those reactions can be very individual to patients and families, depending on a number of factors. And in particular, what was their life like before the day that the cancer diagnosis came? So who are they as children? Who are they as a family? What are their jobs? Where do they live? What's their extended family like? What are their socioeconomic circumstances? What's their understanding and prior experience in the healthcare system? Where are they age-wise, developmentally wise? What do they like? What do they not like? Sometimes we talk about how did they handle pain before? What does that mean for how they're going to handle pain now? So I just want to say, right, we think in terms of what we call social ecology, but that's everything from who is this child before this diagnosis, because that's still the child in front of us, to what was their family, community, and greater circumstances that they're coming into this with. And so we, as a psychosocial team, want to get to know that child and family and all of those factors. And we have different ways to do that. Some is through conversation, some is through a screening that we might do, and further assessment. And in that way, we can tailor our interactions to meet children and their families, including their siblings, where they're at. And we always say care match to need. I know we talk about precision medicine from a medical standpoint, but we also talk about precision psychosocial care to match it to need too. So I don't know if anybody else wants to add anything to that.
I'll just say that, so I'm a music therapist, and I'm part of the Creative Arts Therapies team. There's also art therapy and dance movement therapy offered at CHOP and oncology as well. And we partner with Child Life, and I would say Child Life is integral. I mean, everyone that we work with on the team is very helpful for giving referrals, but Child Life by far gives us the most, as they are assessing the likes of the patient. What are they interested in? What was normal for them before? What was comfortable for them at home and with their family? How are any other social factors that the team is learning about? How are the parents coping? Are the caregivers coping? We get a really great handoff as creative arts therapists for specific referrals. And then I find myself often waiting maybe 4-5 days if they just got diagnosed to introduce myself, because earlier in my career, I would jump right in and introduce myself. But then I realized how overwhelming that time is. They've just transitioned to the floor. They're getting informed and educated appropriately about their diagnosis. Them and parents are meeting so many people on the team at one time that I find that it's kind of just another face and another overwhelming decision to make. And if I let them settle in a little bit, then it's normally more accurately received, I think, of whether they would be interested in music therapy or if that's not their thing. But I would just, shout out to the whole psychosocial team and especially Child Life for giving us great referrals upon diagnosis.
And that's a great point. I work in healthcare, and when Maddie was diagnosed, and I knew the hierarchy of doctors and residents and fellows, and I think 3 days went by and we weren't even sure who our attending was. Not because we're not capable, is because it's so overwhelming in the beginning. So thank you for that point. That's incredible.
to that point, I think that's so important that we often talk about what does every single family who comes in the cancer center get from our team, but people don't get that all at once. But we often say every family has a child life specialist, every family has a social worker, every family will receive education, have access to support groups, and some of these other activities, right? But we're really careful because it is like, some people have talked about it being like a fire hose, like aimed at you. You come in and it's like you're already off kilter because of the diagnosis, and then you've got all of this information coming at you. And the last thing we want to be is like another person throwing all of that at you. And so that's why we're like, the touch base initially is child life and social work, and then we'll build up the rest from there, depending on how things work out and what we see that families need.
I could just add from a parent's perspective that it did seem pretty gentle, meeting people incrementally. Our initial visit, like I said, there was a lot going on. One of the first things we did was meet with it seemed like a panel of genetic scientists came in and wanted to talk with us because having two children with the same diagnosis, and Thomas diagnosis being fairly rare, about 10 kids in the world each year. And some other genetic factors I won't get into that just made it kind of an anomaly. And then going into the education, like here's what you need to expect, here's the medical devices we could end up using, here's the medical devices we're gonna refrain from using, here's what we can expect, and just educating us as needed, but introducing people in the team and the staff incrementally. Most of the time when we would meet someone new, like a therapist, it would be after talking with Susan and really her taking the time to listen to what we needed, and then either recommending support through CHOP or outside of CHOP with the Madelyn James Foundation.
I think something neat, and it took me being in this role to fully understand, is a lot of the times our main goal, right, is the same. It's to support a patient and family, but our scopes are different. So it's, Lamia's right when she says, like, every family gets a child life specialist, every family gets a social worker, and the why behind that, I think, is pretty prevalent. And, we also don't want to overwhelm families, but it makes sense, right, for the child life specialist to go in, because when you're coming in and you're getting this diagnosis, well, that's where the developmentally appropriate diagnosis education comes to play to support and combat that shutdown that I kind of talked about when I first started. Getting some understanding and awareness in a way that you can understand of what's happening to your body. You're gonna get a central line placed. How important to see the central line before and manipulate it and touch it and ask those questions. So just to say, sometimes I think it's so challenging to be like, I don't wanna go and overwhelm this family, but I know how important this is going to be, and every single time without fail, it pays off.
Yeah, I think that's such a good point. And I think too, our experience is having a baby with cancer. So that's what we came into this world knowing. And so I just so appreciate how CHOP does it. And I wish there was funding more for other hospitals to be able to do the same, because having that designated social worker and child life specialist to follow you through that, and then the other supports that you all provide, is truly incredible. We started at a different hospital, great hospital. It doesn't have the funding that CHOP has, and I wish there was even more funding for CHOP. But I think just having that is so important. And one thing that came up for me when you all were talking was, not just the support for the children, but for the parents going through it for the first time. Like, I still remember when Mads got anesthesia for the first time, and they're like, you're holding them in your arms, and they just kind of go limp, and you're like, oh, I did not realize that was going to happen. No one told me about that. Oh my gosh, that was so scary. I just totally broke down. But having that conversation with parents in advance, I think it's so powerful. So again, wanted to say thanks to you all for doing that.
I'm glad you mentioned that, because a couple of things, like you talking about introducing the different steps to the kids. So we went through this with a 6-month-old infant and then a 2-year-old toddler. So Vivian, of course, you couldn't explain it to her. She was just like, you're attacking me. But our son, Thomas, being able to have the child life specialist come in and show him all the steps, it really helped because Thomas, although there were kids who were still scared, you know, like Thomas was not that kid who was screaming when it came time to have blood drawn. He was actually, in fact, just like, oh yeah, here. Like, he would hold out his arm and would sit there and go like, okay, well, let me see what you're doing. And he would talk to the nurses, and the phlebotomist was just like, I've never had a child tell me thank you for taking their blood before.
One time he giggled and said thank you.
Yes, he giggled and said thank you. And then, oh gosh, you were just talking about like how it was different at a different hospital. It wasn't bad, but it was different. And we had the same experience. We came to CHOP the first time around and then thought, you know, like we're gonna go home and we're gonna just come up here every month. Like we're gonna try to stay as normal as possible. And within a few days, we were in the hospital with both kids, and it was a night and day difference. They didn't do anything wrong, but they weren't CHOP. They
From IV sticks to the oncologist coming in and talking with us.
to even child.
Granted, child life, it wasn't the same, like it couldn't compare.
And nobody prepared us for the anesthesia drop either.
Correct.
Not until child.
That's a tough one, yeah. Well, thank you all. I think that's these are such important points too. And I think one of the things I remember from Maddie's time in the hospital was actually like the massage therapy as well, because that was one of the things that they did for babies. And so I did want to kind of share more about what you do, Jackie, and also about, you know, just asking the question of, you know, these are kids, right? Like we do want to make life seem a little bit more normal for them. So how does, you know, like touch and play and creative expression, how does it regulate fear or that therapeutic present side of being in the hospital?
So from a massage perspective, you know, when you think about being in the hospital, for most folks, whether you're a child or an adult, you automatically go into stress mode. The part of your brain that handles that, the amygdala, is just switched on. It's kind of like, I think about it like a smoke alarm that's just going off. And so touch is kind of the equivalent of pulling over a chair, standing up on it, and pushing that reset button to switch off that alarm mode. From a physiological standpoint, there are mechanoreceptors in your skin that immediately send a signal to the brain when you're receiving slow, therapeutic, nurturing touch that flip that switch and basically give your brain permission to start producing other, what I always call feel-good chemicals. People are often familiar with oxytocin. It's the safety hormone. And so there are research studies, there are measurable changes in someone's body chemistry. So it's not just that massage is relaxing, it's actually creating a whole body shift. And also, you know, your experience was with a baby. So when we think about stress, babies don't have the words yet to talk about it, express it. Even when we're adults, sometimes we don't know how to express it, right? And so touch, because it has that effect on, it's like a bottom-up approach. It can help a baby feel safe before they even have words to say that they're afraid. And it also, in the hospital setting, massage helps a child stay connected to their body in a positive way when they're getting so much procedure-based touch. So I think those are some of the primary ways that massage it's more than just a cute little relaxation thing. You know, it really causes a whole body physiological response.
Yeah, that's so important.
Well, no, I was just going to ask, as far as care goes, having a child that has this less, I mean, I would assume these physicians who are doing the chemotherapy or whatever treatment it is, they're better at that because you have this, not stress-free, but a lower stress response. Because I know in our experience with, this turned off, especially when you're dealing with a child that's under the age of 2, they could be crying because of an earache, or they could be crying because their teeth are coming in, or because they don't have an immune system and they have a raging infection. You don't know. And I think to diagnose it appropriately, having these types of therapies just helps the continuum of care and helps with some of the treatment. It's amazing.
Tim, did you want to say something? Oh, just want to make sure. Anyone else want to share anything about that part? Did you all have any experiences with like any integrative supports that really helped Thomas and Vivian in particular that you want to share?
I know that we had Child Life. I know that we had a psychologist. I don't know if it was a specific therapist in mind or anything, but I think it was through the therapy department. So CHOP on different days would have different arts and crafts and therapy sessions for the kids out in the lobby while they were waiting to be triaged or taken into like a room for treatment. And so the kids got to play hopscotch one day, and they've made us wonderful artwork that every kid in every stage goes through. I'm sure parents have plenty of like, I put this in a folder that you made for me when you were 3. They've made stuffed animals. They've gotten T-shirts that they've gotten to draw on, and one thing that was really cool, and I'm blanking on what the name is of the organization, but the therapists helped our kids make pillowcases for their beds because we were not at home. We were living in a house for families with cancer, and so it was nice for our kids to be able to do something to personalize their rooms. And so they got to go through the process of picking out fabric and sitting at the sewing machine and either trying to help or watching the people, like make their pillowcases. And we still have those pillowcases. And they love to tell people, like, this is the pillowcase that I got to make. And they love explaining the whole process of it. And I think another thing, Julie did this actually, but our son, he has a nickname, he's T-Bird. And Thomas loved you guys' badges. And so Julie made him a badge with his picture and his nickname on it. And he had, I think, a Bluey badge reel. And so he got to have a badge when he came to CHOP. So, yeah.
Well, I think, and also I think the messaging that comes to me too is that these aren't luxuries, especially when you're in the hospital, right? Like these help, everything that you said helps restore control, right? It gives kids dignity again, and the parents as well. Like you can control the situation because there's not a lot that's in your control when you're in the hospital and living there. And also that emotional safety. So I feel like that's like a good reminder for everyone of why these integrative health and psychosocial supports are so important. And so the other thing we have to talk about at Madelyn James is access and equity, which is so important in these conversations. And so I wanted to ask the question of kind of everyone, it seems like everyone at CHOP, and it should be everywhere, receives kind of the child life specialist and the social worker, but do all families receive that level of support? And kind of what determines access in general that you all have seen?
So at least at CHOP, we do have that universal, every patient gets assigned a social worker and child life specialist. At least for the social worker, they come into play usually at the time of diagnosis, oftentimes sitting in on the meeting where the physicians are sharing the diagnosis, what they anticipate a treatment course would look like, and are kind of there to support the family as they process this information. Just based off of that and kind of the social worker's role in assessing this family's support and their needs, that kind of determines then how it looks with how we work with our families. Some families may have a lot of great social support in the neighborhood and have a meal train going. Other families may have traveled very far to come and don't know where they'll go for dinner, or even they don't want to leave their child's bedside, so they're eating cafeteria food the whole time. So it really kind of tailoring our interventions to each family's needs based off of our understanding of where they're at and what supports they already have is kind of how we do that precision approach. I don't know if, Michelle, you wanted to talk for child life?
Like you noted, every family gets a child life specialist. I think that keeps coming up, but I know that all of us are like, but I wish every family also got a music therapist and a psychologist and massage therapy. And we're lucky at CHOP that we have enough staffing child life-wise for every family to be able to get a child life specialist. So in terms of access, right, everyone gets one. I think in relation to Ashley's point earlier, where she was saying she gets a lot of referrals for music therapy, art therapy, gets referrals from child life, what we're considering is scoping, an adjustment to hospitalization, and kind of sending our referrals that way. So I think in the most appropriate way, we are delegating where we think, right, the best space could be utilized for that extra psychosocial support to get a music therapist or art therapist.
And I would, oh, go ahead.
I was just going to add similar thought with integrative oncology, which isn't just massage therapy. We have yoga therapy and an acupuncturist on our team, and we often get, so all patients treated through the CHOP Cancer Center are eligible for integrative therapies, but we do get wonderful referrals from psychosocial team, child life. It's like a wonderful collaborative system. Doctors and nurses will refer patients to us. We are a very small team, as Michelle mentioned, so it can be difficult to see everyone, but everyone is eligible, and we're hoping to grow our team.
I think that your mission is so incredibly important. We're talking about the ways in which we provide this universal care to everyone, but I think what you recognize, and we're learning more and more, is that there are different medical outcomes in pediatric oncology based on socioeconomic factors, education factors, and also race and ethnicity. And so we as a team, and I'm talking about the entire cancer center team, have really, as this information has emerged, gotten very serious about thinking about how do we improve access to uninterrupted cancer care for all families who want to seek treatment in our center. And I think that's happening more and more across the United States. We'll start there. So there are different ways that we go about that, right? We have this, what we call the triple PHM, or the psychosocial preventative health model, to think about that precision medicine approach, because we are a very lucky cancer center in terms of the resources that we have, but our resources are not unlimited. And so we have to be really thinking about how do we match care to need and be good stewards of the resources we have. So ensuring families have what they need, but not necessarily always more than they need, because we know there's another family coming through the door So we're really careful. I had mentioned the screening program. One of the ways that we think that we address health equity issues is by making sure we're asking all families who come through our door the same questions in the same way about what they need and not making assumptions about who they are or what they need. I'll never forget talking to a mother who said her son was diagnosed with leukemia, and she was they were relatively comfortable from a socioeconomic status sense, but the team completely missed that they had just moved to that region and were completely disconnected from all their social supports, and she remained isolated over the course of her son's treatment. She said, if someone had just asked me the question and not made an assumption that I could handle everything based on what they saw, then that could have been addressed. So we're trying to do that at key places in the cancer treatment trajectory. So there's a lot that goes on in terms of focus at diagnosis. We're trying to come in at end of treatment. And for those who are coming off treatment, that is also another difficult place for families. And there's a lot of distress and concern at that point. I know we had connected briefly, like, what is life like now? Yeah. And then also, for us at the point of survivorship, we want to do a check back in. And so we're looking at quality of life and potential neurocognitive issues and school issues and household material hardship, as well as caregiver adjustment, trying to make sure that we are asking all families those questions and being able to respond to what they need. Oh.
As Jackie was talking, I kind of thought about how we never got massage therapy recommendations, and well, we never got music therapy referrals. Dang, did we miss out on that? And then it hit me, like, as you were speaking, just like the staff noticed that we were big on skin to skin with our children, and both of them had stomach issues with formula and Pediasure and things like that. And so, they would see us and help us massage and do things like that. And Alexis and I met through music and singing, and we both sing in church. That's a big part of our faith as well, and expressing that. And the children are little praise warriors, and so we made sure that music has always been in our house and in our lungs, in the air around us, and we believe in those healing frequencies as well. And that's so important, and it's probably a responsible allocation of the team to possibly pass up on the Nellers and make sure that someone else who needs that music or the physical massage therapy and so forth is getting it. And that's really responsible on Chop's part.
Something that you mentioned, how the moms, they were comfortable, but they didn't have that social aspect. And for Tim and I, that was kind of us. So we live in Tennessee, but we live in East Tennessee. And both of our parents, our families are all in West Tennessee. So we're already on opposite sides of the state. And then we left Tennessee to come to Pennsylvania for our kids. We didn't have anybody. Well, we had.
We were kind of going our own way in East Tennessee. And
Yeah.
Moving farther away.
And further away. And so it was very isolating. And thankfully, we didn't get to sit in that isolation too long. Our social worker, Susan, was just like, you guys need to do something. And she recommended groups for us to connect with. She recommended events for us to go to. She recommended housing for us to go to where we wouldn't be by ourselves. Like, at first, Tim and I were gonna do, I think, hosts for hospitals, and we were gonna be in, like, an apartment all by ourselves with the kids. And Susan was just like, you guys don't need that. You don't need that at all. We went and lived in a house with 5 other families who were going through different medical diagnoses. And even though we were the only ones there that had children, everybody there either had children or were grandparents. And so Vivian took her first steps around 3 sets of grandparents who cheered her on. Um, and, um, and then Susan also introduced us to Jackie and Dan. You know, she was just like, I think you guys need somebody else who's gonna be in your corner, who is gonna understand exactly what you guys need. And so while Jackie and Dan have been there financially for us, you guys have been there socially and emotionally for us. Like when we tell people, when people ask us, like, how did you get through 2 kids with cancer? The first answer, of course, is always, well, God. And our second answer is always Jackie and Dan and Hannah and Maddie. Because really, like, we wouldn't be here without you guys.
Don't do it. I already cried. You can't do it.
I cried first. It's okay.
And so also, Ariel, I think her name's Brenneman. Okay. It found me and invited me to a men's group, and we went to bowling. I don't think we bowled a single frame. We sat around, we talked, we ate cheeseburgers, and we laughed and cried and walked through each other's stories. And I walked away from there with one friend that I've just been in touch with a lot, and I thank God for him. Dempsey. Quindo. And it just turns out we have a lot more in common than we would have ever imagined.
If it hadn't been for the psychologists and the social workers. Yeah.
Wow, you guys have shared, everyone has shared so many beautiful things. And it sounds like you guys were connected with some really meaningful opportunities for you to build connections and not be so isolated, which I'm sure was in strong part due to your social worker and your psychologist and everyone that you had on your team. So just wanted to kind of go backwards a little bit and address, unfortunately, yes, we don't have a music therapist or a creative arts therapist for every single patient. And I know that you guys, it sounds like spent most of your time, thankfully, at Berger, and not as much inpatient, it sounds like.
Yeah, only a week. That was enough.
Oh, yeah, I'm sure that was overwhelming.
It was enough. It made us really grateful, honestly. Sorry.
We only spent a week inpatient. Vivian had RSV in the middle of chemotherapy. But it made us really grateful because I think every patient, every family goes through this whole, why me? Why are we going through this type of thing? And while we were there, because Vivian's too young to like have those thoughts really, so it was us adults when you have kids that go through this, little kids. And there was a little girl there who was giving out stuffed animals because she spent 165 days in the hospital and she thought every kid should have a stuffy.
Little girl. So I just wanted to mention, at least like in regards to access and equity for the creative arts therapies, that at CHOP at least we are, there are 9 of us music therapists at the main hospital, and we are, I think I can say all on the inpatient side. So there are some other activities that I think Child Life in outpatient helps coordinate with lots of partner organizations where they can do arts and crafts, and they can, I don't know if there's any music, but there's lots of volunteers and people who, thankfully, I think every single day in clinic, they have abilities to interact with each other and engage in that way. So music therapy, art therapy, and dance movement therapy are not outpatient yet. We are mostly focused on inpatient, and just want to mention, like, how do we, if we can't, we're not assigned to every single kid, how do we decide who to see? We have a triage tool and process that we use, and we collect more information from Child Life, social work, the whole team, the chart, chaplains, to, you know, learn, like, how long is their length of stay, and how are they coping? What is their social support system like? Are they often having a caregiver at bedside? Or caregivers kind of dividing and conquering with multiple children? Are they traveling from far away? So all these pieces of information that you're hearing about, we use to, like, the more kind of things that add on, like, you know, how is their prognosis? How are they doing with all these medical all the medical treatment? Are they compliant? Are they doing really well with child life, or is child life saying we're still having a hard time with dressing changes or with medical complaints? All these things that the whole team brings up kind of just keep like piling up in my mind, and I'm like, okay, this one really needs extra support. So when we're trying to make those really tough decisions about, wow, there's so much need, and also especially for infants and younger ones, music therapy is the one creative arts modality that can, like, you're not going to put paint in your mouth. I don't have to worry about that.
Michelle does that.
We can work with patients from birth. So there can be more needs and more requests than we can meet, but we try to always triage that based on the information from the team. And I hope someday that we can be fully an outpatient and covering every single floor of the hospital.
Amazing, yes, let's do that. Great, well, I think it's time to turn to the audience, and I know we have some folks, I don't know, are we able to see if folks online have any questions too? But does anyone have any questions for our amazing panelists and our beautiful audience today? Anyone here? No? I can ask more questions. One of the things I really appreciated that you talked about, Lamia, is the precision medicine. We always say, I was speaking at a conference and it was all about precision medicine for social support. And so that makes me so happy to hear that is actually a term and I didn't just make it up. But I think that's so critical and important is that, I think particularly when we think about, like so many of us in the audience and online who have had children with cancer, every kid has a different protocol, or there's a protocol, and then a lot of times we have to go off protocol, right? And so it should be the same for our social support side of what we do. Does anyone else want to speak to that briefly, or?
Pick up on that since there are just a couple of things going that I'm thinking about. But the first thing I want to say is a lot of what we've talked about when we talk about what does every child and family get is really working within, and I wanted to be able to bring this to the table, this trauma-informed care framework. I think we've been talking around that quite a bit, but we do know and now recognize that a childhood cancer diagnosis can be traumatic for the child, for their siblings, for their caregivers. And a lot of what we're talking about today is all about how do you minimize the trauma experience from the start, because that will give the child and the family more opportunity to be able to manage what's to come, including to manage what's to come as they go, and also to be able to take in and learn more of the coping strategies, adjustment strategies. And so from a child perspective, a lot of that is normalization, learning about their strengths and their capacities, being able to continue to explore and play and create, go to school, be with friends, things like that, depending on their age. And then the other piece that we talk about when I talk about precision medicine is the right intervention at the right time for any particular family. And that is the adjustment over time, because what a family needs on day 10 may be different than what they're going to need on day 20 or 30. It's different than what they'll need during palliative care or end-of-life care versus what they'll need if they're moving off treatment or they're 5 or 10 years down the road. And we do have 20-some-year-olds who are survivors who come back and say, I'm just now starting to grapple with what that meant, right? So we want to be able to support families where they're at with what they need at any particular time.
And I also wanted to, we're talking about integrative health and psychosocial support, and Dan and I have personal experience with the bereavement team at CHOP, and that team is absolutely phenomenal. So if there is anyone that ends up listening to this that needs that type of support, like there is support out there, and there's also other great organizations. Got to give a little shout out to our friends at Zaxbridge that do peer-to-peer mentoring, and other organizations that really help with that, end of life as well. Any other last things anyone wanted to add? Oh, we have a question over here. Great.
Thank you for everybody for being here. We're at the Ronald McDonald House, and we partner with the oncology team. I want to thank you guys for being here. But following up on one of the last things that you spoke about with regards to the referrals and such, how does that work for Jackie to be referred for the therapeutic massages in the hospital? Is it only for inpatient families, or?
I'll just repeat your question if anyone's listening online. Just what is the process of referring for massage therapy in the hospital? All right.
That's a great question. It's a varied process. As I mentioned before, we might get someone from the psychosocial team might put in a consult, so it pops up on my list. For a variety of reasons, they might feel massage is beneficial for this particular patient. Child life, we always work closely with. They become aware of specific needs, social work, and so forth. And then doctors specifically will recommend massage for anything from anxiety and stress relief to actual musculoskeletal work, depending on what the patient is going through. I do have an outpatient clinic, so I toggle between inpatient and outpatient 20 hours a week. So I try to see as many patients as I'm consulted for inpatient, and then 2 mornings a week. I have full 1 hour long slots for folks who are coming for outpatient care. They can actually schedule a full hour session. We have a massage table, so it's a little different than the inpatient experience. I try to make it a little bit like a spa. It's in one of the exam rooms at Berger, but we have some little dim lights, sound machine, and put nice linens on the massage table and try to make it a really pleasant experience. And referrals for that will come from the folks who work at Berger, from really anyone who is part of their care team, from doctors to psychosocial and beyond.
Great. Any other questions? Wonderful. Oh.
I was just thinking, I know we're talking a lot about some of the stuff that you do, that you all do in the hospital. But can you all talk about some of the programming that happens for families and patients either in the hospital or outside the hospital that the psychosocial team is part of?
I'm sure I'm not thinking of everything, but I'm part of, I know that at CHOP they have SIB shops, like sibling shops, and that happens, I think, are you familiar with SIB shops? Okay, I was gonna say, so there's that one, but I'm part of Sibology, which is, we're revamping it, but it's for support for any sibling of a patient in the cancer center, so outpatient or inpatient, and we're, in April, we're having an event, so everyone can learn more about it, and then we'll do quarterly events to help, working with child life, social work as well, help educate the sibling on things that they might encounter in the medical environment, and having them explore things with their own hands, maybe make art with it, and then I hope that there's a little music therapy piece part of it as well. So I know that we offer Sibology support for siblings of patients, oncology patients.
We're big. We're a big group unit. So Steph, I saw your eyes looking right at me. Every day, just for those that aren't aware, we have groups Monday through Friday, twice a day in the playroom, really taking advantage. So I guess this is kind of an important thing to know. We know not every family can get music therapy, or not every family can get art therapy. So something that we do is they have designated days in the playroom for an hour to host a group. So that's being able to touch more patients, and again, in a group setting and not one-on-one. So we have groups every single day. In addition to that, we do a lot of AYA programming, which, Lami, I know you can speak even further to. But when I think of inpatient-wise, we will host at least or attempt to once a week, inviting patients into the teen room. We have a teen room in inpatient oncology. So patients that are 12 and older can come in and kind of take a break from the littles, because everyone needs that every once in a while, and that's okay. So 12 and older will come into the teen room and get to really spend time with peers. And it is just so amazing to sit and see and witness, and seeing how they therapeutically support one another has been very eye-opening. And then in terms of the bigger AYA event, if you want to discuss more, Lamia.
I will say we have an adolescent young adult therapy group for both adolescents and young adults on treatment and adolescents and young adults off treatment. We have been celebrating graduations for a long time, and last year we extended to have graduation celebrations in clinic for all ages, so pre-K, K, elementary school, middle school, high school, college, and we also send and recognize our high school and college graduates through a mailing. We developed a while back a milestones program where patients with their families can select typically one milestone from treatment. That can be different things for different patients and families. And they plan that often with their child life specialists in terms of what do they want that milestone celebration to look like. We have a board with a stars and a chime in clinic. And there's an ability to make posters and have a little party. Sometimes people want to do that. Some people don't want to do it at all, but we're really respectful of what they do. We call that milestones. And then we've really been building our caregiver programming. I know I'm going to forget something, right? Stephanie of Delphine camps. But we've been building our caregiver programming. So we do have this men's group, which is like 4 to 5 activity-oriented events a year. We offer caregiver groups inpatient. We also have virtual outpatient caregiver groups through a partnership with Momcology that we offer every 2 months, so 6 a year. That's co-facilitated by Momcology facilitators and myself or another psychologist, Madelyn. And we have caregiver supports both in Voorhees and King of Prussia that integrate our integrative health team in addition to the rest of the team to provide support. And then we're very involved in camps. So there is now a day camp. There's Ronald McDonald Camp that our team is essentially like helping to partner to run. And we have another camp called Survivor Summit for 18 and olders to go away for a week. That's also in partnership with another cancer family. What else? These are just some of them. Those are the highlights, but this team is amazing. Did you want to add something from integrative health?
Yeah. Well, two things. Back to the question on referrals. I missed the very obvious one. Our director is an oncologist, and she's taken on this other hat to create our program. But one initiative that she has taken on is a culinary medicine program. So from time to time, you'll see a cooking cart over in the burger building, and she's worked with dietitians to develop recipes that are very accessible for families, easy ingredients, easy to make, tasty, but really provide nourishment that folks need that children need when they're going through treatment. So that's been a really fun thing that I think is going to keep growing.
Thank you so much for mentioning that, because a Cancer Center initiative that's actually multidisciplinary is related to that. And we've established a food pharmacy for families who are food insecure. And that is in collaboration with our household material hardship screening, which identifies food insecure families as well. And then the next level is to provide families with bags with recipes to improve nutrition. So it has recipes and all the food that stock items that are required to make these wonderful recipes that Dr. Jubileer and her team have created to improve health and nutrition for our families, which I've heard a lot of people talking about the challenges of having children eat when they're on treatment. So that's been actually a really nice additional program that we've launched.
Wonderful. Yeah, this is all amazing information, and I hope that everyone got a little bit out of this today. Before we go, we always do one thing at the end of our event, but I also wanted to make sure we were able to premiere this I'm sure you're wondering, what is behind you this entire time? Well, this is our wonderful friend, and from United Therapeutics, they have a special Scavolo's World. And this box takes children through different treatment and kind of helps navigate different situations in the hospital and beyond. And so I wanted to share this with everybody in our community and thank our sponsors again from United Therapeutics. You can bring it to hospitals and other places. And so definitely wanted to just show this really quick. It's about a minute long.
Are you ready for some fun? Mission playtime is a go! But fun isn't fun without my best friend, Sari. And my family. Meet Mom. Pops. And my big sister, Jennu. Walking is so boring. Oh, wait. There's an important thing you should know about me. I don't feel good. I have a rare kind of cancer called neuroblastoma. But don't worry. Everyone's taking really good care of me. And although I have to visit the hospital a lot, being sick isn't who I am. I'm still me, the little red panda who loves big adventures. So come and join me in Scavolo's World.
Yay. And I think, this kind of ties back into everything, which is that we're trying to, as teams, as our whole community, is really build things that are meant for kids, by kids, and even, the different therapies that they might need. It's so important to have that kid-friendly content too. So just to end our panel today, we know that medicine fights disease, and this team and families, we all fight for our children too. And we all deserve access to the best care and the full teams behind the cure. And we've learned so much. I know I've learned so much today about all of the amazing different ways that we can support our children going through this. And so we have passed around a little survey to everyone. If you could complete that, that'd be wonderful. So we can make sure we continue these and make them even better for everyone. And for those online, we'll send out a survey online as well. And then just as a quick little Madelyn James announcement, we're actually going to be launching our new website in the next week. So stay tuned to that. We're actually doing a caregiver resource guide for babies, for caregivers who have a baby with cancer. It's something that we never found, and so we decided to make it. So we're excited to launch that soon. And so, Dan, I will let you do the honor of our favorite thing to do after the end of every single Madelyn James event that we do.
Yeah, for those of you that don't know, Maddie's favorite book was The Pow Pow Fish. And we decided when we started Madelyn James that we were gonna end every event, every board meeting, with the end of the Pow Pow Fish. So if you could all repeat after me. I'm a kiss kiss fish. With a kiss kiss face. We're spreading cheery cheeries. All over the place. Smooch. 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 Thank you so much. It's a true honor, and thank you all for being here tonight. that they might kind of make it about. If there's that much, or
First, he was like,
there's